Namaste. We have enjoyed the fragrance and bird songs of springtime and have now stepped into our infamous summer. But let's not get tempted to discard our masks to beat the heat. To say the least, we still need them. On that note, welcome to SLG Hello Doctor, the bi-monthly YouTube channel that brings before you conversations with experienced healthcare experts on topics of health and wellness. Today, we will be talking to Dr. A. Gautam, Consultant Medical Oncologist at SLG Hospitals, Hyderabad, about testicular cancer. Testicular cancer is not very common. About 1 out of every 250 males will develop testicular cancer at some point during their lifetime. Though this may not ring alarm bells, what should is the fact that the incidence rate is inching upwards slowly but steadily over the last few decades, owing to several factors, notwithstanding lifestyle factors. The heartening fact, however, is that testicular cancer has a much lower fatality rate. However, as they say, hope for the best and prepare for the worst. So, let's turn to our guest speaker today and learn more about testicular cancer. Dr. Gautam, welcome back to SLG Hello Doctor. It's so good to have you here with us again.
My pleasure to be here. Today I'll discuss about testicular cancer.
To start with, Dr. Gautam, what is testicular cancer?
Testis is a male reproductive organ that produces hormones and sperms. During the normal fetal development, the testis usually will start in the chest, and as the months pass by, during 6th month it moves into abdomen. By 9th month it moves into the scrotum. So any cancer arising from this testis is called testicular cancer.
In which age is testicular cancer most likely to set in?
Testicular cancer most commonly occurs in young patients. The common age is between 15 to 35 years. Though we have few testicular type cancers which occurs at older age, but 99% of the testicular tumors, they usually occur between 15 to 35 years.
Are there different forms in which testicular cancer manifests itself?
Yeah, there are different kinds of testicular tumors. The two common types are seminoma type of testicular cancer, and the other type is non-seminoma type of testicular cancer. And again, non-seminoma type of testicular cancer is further divided into embryonal cancer, yolk sac tumors, choriocarcinoma, and other rare forms of testicular cancer which forms 1 to 2% include stromal cell tumors and spermatocytic seminoma. And this spermatocytic seminoma usually occurs at older age, at around age of 65 years. And other types of testicular tumors we commonly see in practice are testicular lymphomas.
Doctor, what are the associated risk factors for testicular cancer?
The risk factors that are commonly associated with testicular cancer is cryptorchid testis. As I said before, during the fetal development, the testis, which is initially in the chest, after a few months descends to abdomen, and at the time of birth it descends to scrotum. Cryptorchid testis is failure of the testis to descend from either chest or abdomen into the scrotum. Patients having this cryptorchid testis are at double the risk of developing testicular cancers. And other risk factors for testicular cancer include family history of testicular cancer, either father having a history of testicular cancer or brother or siblings having a history of testicular cancer. And other risk factors include personal history of testicular cancer. Like suppose if we have a right-sided testicular cancer, we are at 8 times more risk for developing a left-sided testicular cancer in lifetime. And other syndromes like Marfan syndrome, Klinefelter syndromes are also associated with testicular cancer, but these are very rare, seen in less than 0.1%.
Doctor, what are the symptoms by which one can be alerted that maybe there is a possibility of testicular cancer?
As I said before, testicular cancer is most common at the age of 15 to 35. And the most common symptom we see in OPD for a testicular cancer is painless swelling near the scrotum for almost 5 to 6 months. Patient come with this complaint commonly to the OPD. The other complaints we see is chronic pain in the scrotum or history of chronic backache at the age of between 15 to 35 years of age. These are the early symptoms of testicular cancer. As the cancer advances, once it spreads to other organs like lungs, patients present with chronic cough or shortness of breath. If it spreads to liver, they can present with jaundice. If it spreads to brain, they can present with seizures or headache. These are some of the common symptoms we see in OPD with patients with testicular cancer.
Doctor, we discussed about the various forms of testicular cancer. Can we now understand how to diagnose these?
Any patient presenting with painless swelling of the testicles, we usually order for an ultrasound of the scrotum. We usually order for bilateral ultrasound because if one testis is involved, there is a chance that 5% that other testis is also involved. So we ask for an ultrasound, and based on the features of the ultrasound, we can tell whether it is a malignant testicular cancer or a benign testicular cancer. So the first test we order is ultrasound. Then the other tests we order are blood tests. We look for certain markers in the blood that helps us to differentiate between benign and malignant testicular tumors. These markers include AFP, beta HCG and LDH. As I said before, there are two common forms of testicular cancer called seminoma and non-seminoma. We can differentiate between these two tumors based on markers itself. In seminoma, the markers that I said before, AFP, beta HCG and LDH will be normal. Whereas in non-seminoma, these markers like AFP, LDH and beta HCG will be elevated. So once we do an ultrasound, we get to know whether it is a malignant testicular tumor or benign testicular tumor. Ultrasound followed by these markers will tell us whether it is malignant or non-malignant. And followed by further staging, we either do a PET CT scan to know the stage of the disease or CT scan of the chest to know the stage of the disease.
Thank you, doctor, for that very clear explanation. Now, what is the treatment modality once you figure out that there is indeed testicular cancer that's set in?
The initial treatment for any stage of testicular cancer is high inguinal orchidectomy. High inguinal orchidectomy is something called, we remove the testis and send it for pathology department to know the type of the tumor that is there in our body. The treatment modality is usually dependent on the stage of the disease. For stage 1, maybe only high inguinal orchidectomy, is enough. Or based on the risk factors on the pathology, we can offer chemotherapy or radiation. For stage 2 and stage 3 tumors, we have to definitely treat it with a chemotherapy compulsorily.
When or at what stage is surgery recommended, and is it really effective in eliminating the disease?
The difference between testicular tumors and other type of solid tumors we see in human body is testicular tumors is usually staged into 3 stages, stage 1, stage 2, stage 3. Whereas other tumors we stage into stage 1, stage 2, stage 3 and stage 4. So, and coming to surgery is indicated in all stages of testicular cancer, whether it is stage 1, stage 2 or stage 3. Because testicular tumors are one type of tumors that are highly curable. Even in stage 3 testicular tumors, the overall survivor is around 90% since they respond very well to surgery and chemotherapy. So to cure a testicular cancer, surgery is recommended. Whatever the stage it is, compulsory surgery is recommended for the patient.
Let's take a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor, where we are talking to Dr. A. Gautam, Consultant Medical Oncologist at SLG Hospitals, Hyderabad, on the very important topic of testicular cancer. Doctor, if the surgery requires the removal of testicles, then what is the prognosis for fertility especially?
As I said before, chance for cure rate in testicular cancer, even if it is an advanced stage, there is 90% chance for cure rate. And mostly these patients are young patients between 15 to 35 years. So once we remove the testis, this can lead to infertility and this can lead to many problems. So what do we suggest is, before removing testis, we ask for a sperm preservation to be done. So it is mandatory, and tell every patient to go for a sperm preservation before undergoing a surgery or chemotherapy in patients with testicular cancer.
Doctor, what's the appropriate follow-up care to be taken after the operation?
After the surgery, patients are usually advised rest for 1 to 2 weeks, followed by suture removal, and after the removal of suture, we can go ahead with chemotherapy.
Doctor, as in other cancer treatments, does chemotherapy play a role in testicular cancer?
As I said before, testicular cancer is a very chemosensitive cancer. So chemotherapy definitely plays a role in the testicular cancer. In early stages, we usually give 1 cycle of chemotherapy, but as the cancer advances, or if it is in stage 2 or stage 3, we generally give 3 to 4 cycles of chemotherapy. The testicular tumor is very chemosensitive, so patients respond very well to chemotherapy.
Doctor, now that we've established that chemo is very effective, what is the follow-up care after chemo? Because there are so many side effects.
These testicular tumors, if they reoccur, they usually reoccur within first 2 years. So first 2 years is very crucial to diagnose the disease again. So what we do is, first 2 years, we usually follow up the patient for every 3 months, and we ask for ultrasound, and these markers, as I said before, AFP, LDH and beta HCG every 3 months for first 2 years. After 2 years, we usually ask them to come for 6 months for 3 more years. And after 5 years, we usually follow up them for every 1 year for 3 to 4 years, and then we stop.
Doctor, is testicular cancer at all a genetic disease? And let's say a father has, what precautions can the son take to maybe prevent its occurrence or at least delay its onset?
As I said before, there is high chance for testicular cancer to occur in family. If father is affected or if sibling is affected, there is a high risk for testicular cancer. So as per se, there are no guidelines for the testicular cancer, but if the person has symptoms like testicular swelling or any chronic testicular pain, then he should visit the doctor as soon as possible.
Thank you, Dr. Gautam, for your deep insights about testicular cancer. We are so glad that we had this conversation with you today.
My pleasure to attend this session, and I hope what we discussed today will help our viewers.
Viewers, we'll be back with you in 2 weeks from now with a very important conversation centering around heart bypass surgery. Until then, be safe, be happy, and stay healthy. Namaste. Viewers, hope you've hit the bell icon and are following all that's happening on SLG Hello Doctor. If not, do it right away.